Shri Upendra Yadav ji, Honorable Deputy Prime Minister and Minister of Health, Government of Nepal, Shri Ravi Shankar Prasad ji, my senior leader who brought me into politics and who's the Union Minister for Law and Justice and Electronics and Information Technology, Government of India, Excellencies representing their respective countries, Dr. Poonam Khetrapal Singh, Regional Director, World Health Organization, Southeast Asia Region, Preeti Sudanji, Secretary, Ministry of Health and Family Welfare, Government of India, Shri Sanjeev Kumar ji, the Additional Secretary, Ministry of Health and Family Welfare, Government of India, Mrs. Sidhu, the Australian High Commissioner, Tim Kilse, the Chief Executive of Australian Digital Health Agency, distinguished delegates, ladies and gentlemen. I am delighted to welcome you all to the 4th Global Digital Health Partnership Summit. I also express a warm welcome to my distinguished colleagues, the Ministers of Health and delegates accompanying them. I also welcome the international and national experts, WHO participants and representatives of ministries, Government of India, who are gathered here for deliberations on digital health partnership. As we know, this summit is a sequel of the Global Digital Health Partnership events held in January 2018 in Australia, April in 2018 in Washington, D.C., and September 2018 in London. I distinctly remember that I was part of the first summit at Canberra, Australia, where India had agreed to host the 4th major summit in Delhi on the request of my esteemed colleague, Minister of Health from Australia. We feel privileged today to host this event with such an expanded coverage in terms of number of the countries and technical areas of intervention. The entire healthcare system in India and the world is undergoing a rapid transformation. The way we know of healthcare being delivered and accessed is poised to change for better. The digital health interventions are accelerating this transformation. It has a huge potential for supporting universal health coverage for which the Government of India is committed. India's National Health Policy 2017 outlines a robust framework towards achieving health for all through the basic principles of accessibility, quality, and affordability that leverages the power of information and communication technologies to strengthen the healthcare delivery systems. I feel proud and privileged to highlight the quantum leap made in India under the leadership of Honorable Prime Minister Shri Narendra Modi ji to secure universal health coverage for the underprivileged and deprived section of our society with the launch of the comprehensive healthcare scheme by the name of Ayushman Bharat, Long Live India, which is popularly known as Modi Care also. It rests on twin pillars of health and wellness centers at the primary and the secondary levels of healthcare, and PM Jai, which is known as PM Jan Arogya Yojana, the National Health Insurance Scheme, popularly known as Modi Care, at the tertiary level. We plan to have 150,000 health and wellness centers at the primary health center and sub-center level, which provide not only curative services, but also preventive and promotive healthcare services to citizens at the cutting edge, whereas Modi Care is the biggest government-sponsored healthcare assurance scheme of the world, catering to 40% of the Indian population, covering 500 million people. It provides an insurance coverage of 500,000 Indian rupees per year to each eligible family. I am happy to share that after the rollout of Modi Care, in merely 155 days, nearly 1.3 million people have availed the benefits of more than 16 billion rupees under this scheme. Ayushman Bharat is primarily dependent on maximizing the use of digital tools for effective implementation and monitoring. The scheme is completely digital wherein all processes from beneficiary identification to hospital empanelment and settlement of claims are done electronically. Hence, the benefits of the scheme are delivered in the mode that is cashless, paperless, and completely transparent for all stakeholders, and it is transferable also. Not only this, but a poor illiterate beneficiary can access all services solely through his thumb across the length and the breadth of the country. Through robust digital interventions, we have ensured that continuum of care across primary, secondary, and tertiary facilities gets delivered. We have embraced digital health to achieve the targets of UHC. Our engagements in this arena has been a long history of contributing to the digital health ecosystems. The informatics infrastructure of the country took its shape in 1976 with the creation of the specialized agencies for software and information infrastructure. India took digital health to the world stage by introducing and eventually adopting the World Health Assembly resolution on digital health at the 71st session in Geneva. This resolution drew global attention to the potential challenges and opportunities for digital health interventions and the need for closer collaboration on the issue globally for achieving health-related SDG targets, as well as WHO's implementation of the 13th General Program of Work. 4th Global Digital Health Partnership Summit and the International Digital Health Symposium is an effort to support the vision articulated in the World Health Assembly resolution on digital health. The two-day agenda encompasses not only the discussions on the 5 work streams of the Global Digital Health Partnership, but also broad-based itself from a delivery perspective on issues of topical interest. These include discussions on digital health ecosystems for universal health coverage, integrated platforms for e-learning, integrated disease surveillance and disease registry platforms, telemedicine and remote monitoring, and integrated clinical decision support tools for primary care. The health ministers will also have an opportunity to discuss and consider new ways to broad-based digitalization for healthcare in their respective countries. I am confident that Indian diaspora will also be benefit from the deliberations and decisions of this summit. In India, our Honorable Prime Minister has already directed us to aspire towards creating an integrated digital health platform and have longitudinal electronic health record for 1.3 billion people of India. As a part of this journey, the National Digital Health Strategy is already in place. The National Health Stack as a common good will be made available to all to facilitate creation of electronic health records. A National Resource Center for EHR standards has also been set up in order to augment facilitation for adoption of the notified EHR standards. Indian government has notified health informatics standards and have approved metadata and data standards for enabling seamless exchange of information across care providers to make these systems interoperable and to build electronic health records of the citizens. India has rolled out large-scale IT systems across spectrum of healthcare ecosystems to enable effective people-centered health services for all. We have implemented digital technology in public health in India in 4 major areas, which include improving of health service delivery, improving compliance of people towards health and care, engaging citizens in partnering with government and planning, management of health services delivery, and improving governance. Our ministry is in the process of establishing information platform for interoperability amongst various health IT systems and a pan-India exchange of electronic health records for citizens, ensuring privacy, security, and confidentiality of data. The same is to be supplemented by pan-Indian network of disease surveillance, telemedicine, and teleradiology and teleeducation. This summit is an important forum for bringing innovative thinking on contemporary digital technologies, issues I took forward for the tangible outcomes of digital health through the summit and symposium impacting healthcare delivery models across the world. Let me conclude by saying we are witnessing an extraordinary time and opportunity for India and to the rest of the world. The power of transformation of digital health and healthcare cannot be understated. Digital health intelligence and interventions such as the big data analytics, artificial intelligence, machine learning, robotics, Internet of Things, all will change the way health is delivered. Let's collectively ensure that the digital health will bring better health for all and no one is left behind. I thank the ministers globally for giving a high priority to this agenda, for being with us to deliberate in this occasion. Thank you very much for giving me a patient hearing.